Hello, my name is Lillian Bravo. I'm the Director of Public Health Partnerships at the Yakima Health District. In response to the COVID-19 epidemic, we have prepared additional materials for you. Today, we will be talking about what additional precautions you can take at home to protect yourself, your family, and the community. To tell you more about what these precautions are, you'll be hearing from Erica Ochoa, a community health specialist here at the Yakima Health District.
Hello, my name is Erica Ochoa. I'm a community health specialist at the Yakima Health District, and today I will be sharing some COVID-19 health information. What is COVID-19? Coronavirus disease, or COVID-19, is a respiratory illness that can be spread from person to person. There are many types of human coronaviruses, including some that commonly cause mild upper respiratory tract illnesses. COVID-19 is a new disease caused by a novel or new coronavirus that has not been previously seen in humans. How does COVID-19 spread? People can catch COVID-19 from others who have the virus. The disease can spread from person to person through small droplets from the nose or mouth, which are spread when a person with COVID-19 coughs or exhales. These droplets land on objects and surfaces around the person. Other people can then catch COVID-19 by touching these objects or surfaces, then touching their eyes, nose, or mouth. People can also catch COVID-19 if they breathe in droplets from a person with COVID-19 who coughs or exhales droplets. People are thought to be the most contagious when they are symptomatic or exhibiting symptoms. Most recently, though, the virus has also been detected in asymptomatic persons or those who do not show symptoms. Here's an example of how the coronavirus is spread from person to person. And if one stays home and limits their contact with other people, is how we can stop the spread. The houses here represent staying at home and not growing the spread of COVID-19. How severe is the virus? Information from the Department of Health website as of April 20th show 12,282 cases in Washington state and 682 deaths. Here in Yakima County, as of April 21st, there are 886 cases and 38 of those have resulted in death. Please keep informed and follow the advice of the local health authorities, including any restrictions put in place on travel and gatherings and work. What are the symptoms? Experts are still learning about the range of illness from novel coronavirus. Reported cases have ranged from mild illness, similar to a common cold, to severe pneumonia that requires hospitalization. People who have been diagnosed with novel coronavirus have reported symptoms that may appear in as few as 2 days or take as long as 14 days after exposure to the virus. Symptoms include fever, cough, and difficulty breathing. Some patients may have aches and pains, nasal congestion, runny nose, and a sore throat. These symptoms are usually mild and begin gradually. Some people become infected but do not develop any symptoms and don't feel unwell. Who is at risk? In Yakima County, we have seen significant spread of the virus in our community. For this reason, people who live in Yakima are considered to be at an elevated risk of exposure. Certain workforces can be more at risk due to the nature of their job and lack of social distancing. Based on currently available information and clinical expertise, older adults, pregnant women, and people of any age who have serious underlying medical conditions might be at higher risk for severe illness of COVID-19. Based on what we know, those at higher risk are people 60 years and older, people who live in a nursing home or long-term care facility, and people of all ages with underlying medical conditions. How can I protect myself? Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home as much as possible and avoid close contact with people who are sick. Put distance between yourself and other people. Remember that some people without symptoms may be able to spread the virus. Keeping distance from others is especially important for people who are at higher risk of getting very sick. Cover your mouth and nose with a cloth face cover when around others. You could spread COVID-19 to others even if you do not feel sick. Everyone should wear a cloth face cover when they go out in public, for example, to the grocery store or to pick up other necessities. Cloth face covering should not be used for children under the age of 2, anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. The cloth face cover is meant to protect other people in case you are infected. Do not use a mask meant for a healthcare worker. Continue to keep about 6 feet between yourself and others. The cloth face cover is not a substitute for social distancing. If you are in a private setting and do not have a cloth face covering, remember to always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them using detergent or soap and water prior to disinfecting. How is COVID-19 treated? Although there are no medications specifically approved for coronavirus, most people with mild coronaviruses will recover on their own by drinking plenty of fluids, resting, and taking pain and fever medications. However, some cases develop pneumonia and do require medical care or hospitalization. What to do if you are sick? Stay home except to get medical care. Most people with COVID-19 have a mild illness and can recover at home without medical care. Do not leave your home except to get medical care and do not visit public areas. Take care of yourself and get rest and stay hydrated. As much as possible, stay in a specific room and away from other people in your home. Also, you should use a separate bathroom if available. If you need to be around other people or outside of the home, wear a cloth face covering. Monitor your symptoms. Common symptoms of COVID-19 include fever and cough. Trouble breathing is a more serious symptom that means you should get medical attention. Follow care instructions from your healthcare provider and local health department. When to seek medical attention includes trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, and bluish lips or face. Call 911 if you have a medical emergency. Notify the operator that you have or think you have COVID-19. If you have a medical appointment that cannot be postponed, call your doctor's office and tell them that you have or may have COVID-19. This will help the office protect themselves and other patients. If you are sick, wear a cloth covering over your nose and mouth. Cover your nose and mouth with a tissue when you cough or sneeze. Wash your hands with soap and water for at least 20 seconds. If soap and water are not available, clean your hands with an alcohol-based hand sanitizer that contains at least 60% alcohol. Avoid sharing personal household items like dishes, towels, or bedding with other people in your home. Clean all high-touch surfaces every day. Be sure to follow the instructions on the label to ensure the safe and effective use of the products. When to discontinue home isolation? People with COVID-19 who have stayed home can stop home isolation under the following conditions. You have had no fever for at least 72 hours, that is a full 3 days of no fever without the use of medicine that reduces those fevers, and other symptoms have improved. For example, your cough and shortness of breath, and at least 7 days have passed since your symptoms first appeared. Now here is a video that has the recommendations for all of our community so we can stop the spread of COVID-19.
In the Yakima Valley, we're used to getting out and enjoying our local community. But with COVID-19 or coronavirus, leaving our homes can put ourselves, our families, and others at risk. If you come into contact with the virus, you can spread it to others, and they can pass it along without knowing it. How can you keep others safe? The Yakima Health District says the best approach is to act as though you already have the virus. First, stay home. While home, wash your hands thoroughly. Sanitize surfaces and cover your cough. If you go out, stay 6 feet away from others so the virus cannot spread. Our Yakima community is in this together. Take action now to protect your family and our community. Learn more from the Yakima Health District at yakimatogether.org.
For more information, you can find us on our website at yakimahealthdistrict.org. For other resources, you can also go to yakimatogether.org. And for community resources related to COVID-19, you can also dial 211. Thank you.
Thank you for your time and listening to this important matter. Remember that we all have a part to play in stopping the spread of COVID-19, and by following these public health recommendations, you will be protecting yourself, your family, and the community. Thank you.